Hey everybody, welcome to Therapy Thursday. So over the last couple of weeks, there's been a big deal about the Health Information Exchange in Oklahoma. So I wanted to bring in Dr. Ford so that he could give a little bit of an explanation of what that looks like. And then I'm going to touch on a few points for providers and patients going forward.
Yeah, so Health Information Exchange, also known as HIE, is actually nothing that's new around our country. And as it relates to integrated care, managed care, and other healthcare organizations, fortunately, and I say fortunately, it's something that our state has adopted to start using July 1st, 2023. This is a huge opportunity for us as behavioral health providers to improve the care for the patients that we serve, reduce costs, and improve the patient experience. HIE is something that is needed desperately in our state. The reason that I say it is desperately needed in our state because we rank towards the bottom in our state as health disparities and outcomes in care. This is something that is going to be designed and is designed to improve the outcomes of care and improve the patient experience and reduce costs, something that our state desperately needs. Healthcare in our state has continued to rise for many, many years. Thankfully, they've decided to use HIE as a tool to improve the way that we provide healthcare. And this is something as behavioral health providers, we need to be supporting and understanding. If you do not understand it, I strongly suggest that you do your research and investigate and understand how you as a provider can benefit and the population that you're serving can benefit from utilizing and maximizing the HIE experience. As I said before, this is nothing that's new. This is something that's being used in many other states, and now our state is going to get the opportunity. And as behavioral health providers, this is an opportunity to step up and be part of change and not be resistant or go against change. I understand that change is very uncomfortable for many, but this is an opportunity that's going to allow us to provide better care for the patients and the population that we serve. This is an opportunity that we have to take advantage of. And I desperately ask you, if you do not understand what it is, please do your research. You can reach out to myself. You can reach out to my office. I'm willing to speak to anybody. I'm willing to do a Zoom call. I'm willing to do anything that I can to help you understand and help you understand why this is something that our state must take advantage of.
So for providers, there's been a lot of contention because a lot of them are talking about there's a lot of misunderstandings about it. The bill isn't written very clearly. And so there is a lot of information that is being left out. But the thing is that this is really a connection of behavioral health providers and physical health providers.
Yes.
This is how we are going to improve outcomes. This is how we improve quality of care. This is how we increase collaboration, which is something that Oklahoma really needs. We don't have a lot of collaboration of care, especially between physical health specialists and behavioral health providers.
Integrated care.
Yeah, this is the road to integrated care. This is the road to managed care and integrated care. Managed care is on the horizon, and this is only preparing us for that. Now, I know that some of the contention has been that people are afraid that the government is going to have access to their mental health records or diagnoses, and that they're going to be treated differently because of that. The HIE is HIPAA compliant. It is still protected health information. There is no reason for anyone that is not on your case to access your information. That doesn't change here. This just gives those people who are on your treatment team and on your collaborative care team the opportunity to have real-time results from the providers that you're seeing.
Which is designed to decrease the overutilization rate in care. There's a lot of procedures that are being duplicated. For instance, say you recently visited your PCP's office and they screened you with a PHQ-9 or a GAD-7. Well, now we have access to that, and there's no reason for our office to duplicate that same screening or do that same test. Now we can use the results from that test and make decisions and differences in your care. Or if you're on a medication and the PCP looks at our PHQ-9 and say you're on an antidepressant and it actually is working, your scores are lower. This is designed to improve care, improve costs, and improve the patient experience.
And if you think about it, 80% of people express behavioral health conditions or issues to their primary care provider, pediatrician, or even OBGYN before they are actually coming for behavioral health services.
And in the
So
emergency.
how do you think that they are going to give that referral? They're going to put it in the HIE and send that referral to us the same way they would now. It's just now we would be able to access it real time rather than waiting a day or two to gain the information and then get you on the schedule. So it's going to expedite your care as well.
Yes.
And many people are stating that it's going to actually increase wait times. But the only reason and the only way it would do that is if mental health providers and behavioral health providers opt out. That's the only way that we're going to decrease the quality of care, is people not buying into the new system and not being willing to move with the change that needs to happen for the state to improve the quality of care.
Yes.
For patients, I just wanted to reach out to you and just let you know, this does not mean that all of your health information is out in the world like it would be on Facebook or something like that. This is still protected information. It is still HIPAA compliant. It is the exact same type of system that your physical health provider and your specialist that you're seeing are utilizing right now. It is only now going to include specialty and auxiliary services and behavioral health services.
Yes.
So it's only going to increase collaboration, improve positive outcomes, and improve the quality of care. And that's what we're all after.
Yes, something our state desperately needs.
And also, it could also allow us to do more trauma-informed care, which is important because now you'll have access to those trauma screenings that are being completed in the behavioral health environment. Mm-hmm. So that way, physical health people or physical health providers are going to be able to access that and then change the way that they are conducting their treatment of you into a more trauma-informed care approach. So we hope that this answers some questions. If you have any other questions, you're always welcome to reach out to us. We would love to meet with you. We would love to do a Zoom or even phone calls. Please feel free to email us, and you can reach us through the website at www.h2gy.com. You can also always respond or comment on any of the videos or reach out to us on socials. We will see you guys next week, and I hope you have a good one.
Thanks.
Thank you.